Supraspinatus, acromion process. Follow the spine of the scapula to the medial border. Just come above that and then press down. And then from there, what Mayumi is going to try and do from there is very gently just to try and push me over with the hand. So from there, if I step away, what Mayumi is doing is just lifting the arm out to the side. And again, just nice and gently. Supraspinatus. From the acromion process, follow the spine of the scapula to the medial border. Just come above that and then press down towards their feet. And as they lift their arm out to the side, then they will activate the muscle. Supraspinatus. There is the spine of the scapula, the medial border of the scapula. Above the spine of the scapula is supraspinatus, superior, above the spine of the scapula. It initiates abduction at the glenohumeral joint, so abduction of the arm. It will lift the arm out to the side. Infraspinatus, the medial border of the scapula, the lateral border of the scapula, spine of the scapula in that triangular area, finger into the belly from there, and then all we need to do from that position there is ask them to put their palm down, keep the little finger onto the table, turn so that the thumb is going up towards the ceiling. Lateral rotation. Again, medial border, lateral border, spine of the scapula, into the belly of that muscle. Thumb is down, they keep the little finger down and turn so that the thumb is coming up towards the ceiling. Lateral rotation. Infraspinatus. Below the spine of the scapula is infraspinatus. Infraspinatus will do lateral rotation at the glenohumeral joint. For teres minor, we just take the arm out. We've already located the posterior deltoid, armpit, shoulder, halfway. If we just get them to lift the elbow up towards the ceiling, feel for the border of the posterior deltoid, they can now put their arm down, but we've got to try and get underneath the deltoid and push, as if you're pushing across towards the ear on the opposite side. So you're pushing towards the lateral border of the scapula, and all that Mayumi is going to try and do is to bring the forearm up. So there's no movement of the upper arm, either away or off the table. It's just the forearm that's working to do that. So just bring the forearm up again, and down, and just lift it down just a fraction, and again. And that's lateral rotation. So infraspinatus, teres minor, both do lateral rotation. The small muscle just underneath infraspinatus is teres minor. Teres minor also will assist to do lateral rotation at the glenohumeral joint. If we're looking at teres major, and teres major is not always included as part of the rotator cuff muscles, but teres major is just along the lateral border, and then from there, very gently, my thigh is against the elbow. What Mayumi is going to try and do is with her elbow just try and push me over, and then this muscle just jumps up. Teres major. Supraspinatus, infraspinatus, teres minor, teres major. So the one that we need to try and get to now is subscapularis. This muscle is teres major. Some people will include that in the rotator cuff muscles, other people will not include that. Teres major goes around to the front of the humerus, the anterior part of the humerus, close to the bicipital groove. Now, in order to find subscapularis from this position here, what we're going to ask Mayumi to do is to slide with the shoulder coming off the edge of the table, and the feet across towards the opposite side so they don't fall off. And then from here, you're going to lift that up and then try and get underneath so you're not going to invade breast area, and then slide that right across. This hand here is bringing across, The bottom hand is trying to push in as far as you can. Once you get in as far as you can, then you go really deep inside there and just curl your fingers up towards the ceiling. So lift up, underneath, and curl up. All that happens now, Mayumi is just very gently just going to turn that in, and it can be really painful. So it's the medial rotation that creates the problem. So from there, okay, away we go. Nice and easy, careful. That's the idea. And then as we go, each time you can move this hand that's underneath to a different position to get to the subscapularis. Subscapularis is the major medial rotator. Lift that underneath the scapula, so you're on the front of the scapula. You're trying to abduct as much as you can and push in as far as you can with the lower hand. Curl your fingers, and they do medial rotation. So if they do this really quickly, it's going to hurt them. That's their problem. Really nice and easy. So you advise them slowly, slowly, slowly. Subscapularis. This time you're going to locate latissimus dorsi. So locate the inferior angle of the scapula, iliac crest, palm of the hand between the two, inferior angle, iliac crest, palm flat across. They bring their arm out to the side. And this time what Mayumi is going to do is to try and bring the elbow across her back towards the hip on the opposite side. But you will need some resistance, so very gently go ahead, lift across, and that will tighten up from there. It will not necessarily jump out and hit you quite strongly, but it will tighten up. Inferior angle, iliac crest, halfway. The fingers are going toward the shoulder on the opposite side. Put some resistance onto the elbow. They're going to try and bring their elbow across their back towards the hip on the opposite side. Latissimus dorsi. This big muscle here is latissimus dorsi. So it comes from mainly T6, goes all the way down via the aponeurosis, follows the ilium, attaches to the ribs, goes underneath, comes to the front of the humerus, to the bicipital groove. So it will do extension, bring the arm backwards. It will do adduction, bring the arm in towards the side. We'll also do medial rotation as well. Extension, adduction, and medial rotation. Latissimus dorsi. From there, if we put the arm onto the table, find the dorsal spines, find the midlateral line, so we're into the waist area. Halfway, the thumbs are going to push towards the vertebral column. Mayumi is going to lift the head up, lift the chest up, and do a lateral bend, so a side bend. So lift up and then side bend, and the muscle jumps out and hits you. Dorsal spines, midlateral line, halfway, thumbs, be careful, head up, chest up, and side bend, lateral flexion. And just to the lateral side in the lumbar area is quadratus lumborum. So quadratus lumborum comes from rib 12, attaches to the lumbar vertebrae, the transverse processes, and to the ilium. Quadratus lumborum. Whilst we're in the lumbar area, either side of the vertebral column, and this time lift the head up and the chest up, and it's these great big chunks of muscle on either side, the erectospinae. Extension, lumbar vertebrae, cervical vertebrae. A different angle for the erectospinae, either side of the lumbar vertebrae. Mayumi lifts the head up, the chest up, arches the back, lumbar extensor muscles, the neck extensors would also be working to do that. So, erectospinae group of muscles. Erectospinae, either side of the vertebral column, into the lumbar area. Mayumi lifts the head up, they will start to work to do that. And then the chest comes up, arching the back, and it's these great big chunks of muscle on either side of the vertebral column, the erectospinae, sacrospinalis, paravertebral muscles, different names that are given to the same group of muscles, the erectospinae. A group of muscles that comes from just behind the ear onto the occipital bone, and then comes all the way down, very close to the vertebral column and all the way down via the upper neuroses. The strap of muscles collectively is called the erectospinae muscles. Erectospinae muscles, the back strap muscles, different names that are given to the same group of muscles. So they come from behind the ear and they collectively come all the way down, attaching to ribs to the vertebral column and all the way down. They will lift the head backwards, extension. They will also lift the torso, as in lying face down and lifting the head and the chest off the floor, off the table. So they will do extension. They will also partake in lateral flexion of the vertebral column. The erectospinae muscles. Onto the trapezius muscles, upper trapezius, the muscle in the neck region. Fingers into the neck area. Mayumi is just going to shrug the shoulders, lift the shoulders, the scapula up towards the ear. Middle trapezius, elevation. Does other things as well, but in this particular case, elevation. Upper trapezius. Upper trapezius will do elevation of the scapula, and it will also do lateral flexion of the cervical vertebrae. If we then look at middle trapezius, acromion process, follow the spine of the scapula to the medial border, 3 fingers straight across from there, and then into the middle. We don't need an arm to move the scapula, and all that we need from there is Mayumi to try and make the shoulder blades touch. That's primarily middle trapezius to do that one. Other trapezius will work, but that's middle trapezius. Middle trapezius. The middle trapezius, a deduction, and then from there, if we find the inferior angle, the superior angle, roughly halfway along the medial border, inferior angle, superior angle, halfway along the medial border of the scapula, halfway between the medial border and the vertebral column. Mayumi now is going to make like Superwoman, and then in order to try and stop the erectors from working, we're going to get them to push their head into the table, keep pushing, and then try and lift this arm up, and that would be lower trapezius. So again, the forehead pushes into the table, keeps pushing whilst we try and lift the arm up, and that will activate the lower trapezius. And lower trapezius. The lower trapezius, a deduction, and then it will do some rotation, some lateral rotation of the scapula, and it will also do some depression of the scapula. Retraction and depression, so it does quite a lot. For most of us, this is non-existent because we don't do the work that's associated with that kind of movement. From there, if we get Mayumi to put the back of her hand onto her lower back, take up the same position as we did for lower trapezius, and this time try and lift the back of the hand and the forearm off their back, and that would activate rhomboids. Exactly the same position for lower trapezius and for rhomboids. Inferior angle, superior angle, halfway, then halfway between the medial border and the vertebral column. In this occasion, lift the hand, the forearm off, and that would be rhomboids. It's working to do that. Rhomboids will do a deduction, so they'll bring the scapula closer towards the vertebral column, and because of the direction, they will also do some elevation. They will lift the scapula up as well.